So this chapter is on bleeding. In the average adult, there's anywhere between 5 to 6 liters of blood. So depending on the size, some people are bigger, other people are a little bit smaller. So this volume will vary. As far as what the term bleeding means or hemorrhaging, hemorrhaging is just losing a large quantity of blood in a short amount of time. So, when we talk about rapid blood loss, rapid blood loss could result in shock, and in addition to that, rapid blood loss can also lead to death. So these two things are what we're afraid of, immediately when we lose blood. In addition to that, again, other things that are happening as well. But what are the quantities as far as that goes? So when we talk about quantity of blood, we fear in adults, if there's more than a liter of blood loss, that can result to these two things. Or in children, we're talking about less than that, perhaps half of that, about half a liter of blood loss in a child, that could result in shock and death. So there's as far as different types of bleedings go, we're talking about arterial, venous, as well as capillary bleeds. So probably everyone has had this first type, okay? This is a capillary bleed. And in a capillary bleed, the blood is oozing out, okay? So we have slow loss of blood. And again, this is relatively harmless unless you have if you're hemophilic or you have some type of a clotting disorder, you're not going to die from blood loss. There's a very limited amount of volume of blood that's being lost, unless it tends to be, well, let's not go into other tangents or exceptions, but we'll just say, generally speaking, small capillary blood loss that is on the finger over here is going to be relatively insignificant in terms of blood volume loss. When you look over here, the next photograph they're showing you, this is probably a venous bleed. So a venous bleed, we're talking about more quantity of blood being lost, and this is a flow of blood. So you have blood flowing out over in a venous bleed versus, you have an oozing of blood in capillary blood loss. And then finally, when you look at arterial bleeds, these are ones where there's a significant amount of blood loss and the blood is coming out in pressure. So what do we see when you have blood or any fluid that's in pressure? You will see force. So there's going to be blood spurting out of arterial bleeds. Also, color is going to vary. Whereas venous blood tends to be more darker in color, arterial blood is going to be a bright red color. So it's almost like a candy apple red, I guess, if you want to describe it, a better description of that color. In response to bleeding, your body will do a couple of things. There's first, again, naturally, your body's going to respond by what's called this blood vessel spasm. And essentially, this blood vessel spasm, what ends up happening is the smooth muscles around the blood vessels, they will constrict. As they constrict, the blood vessels become stronger, hence the rate of blood loss decreases as well. At the same time, while the blood vessel is spasming, there's clotting proteins, or clotting begins as well. And in terms of clotting, we're talking primarily about clotting proteins as well as platelets that come to cover the hole. Okay, they end up repairing. It's the process that repairs the leak in the blood vessel. So this is the platelets. Think of them as a protective covering for the wound. In addition to that, they're repairing the broken blood vessel. When it comes to caring for any type of a bleed, okay, so in this case, we're talking about external bleeds, but we always have to take universal precautions. And taking universal precautions, the easiest thing that you can do, wear gloves. Okay. Aside from wearing gloves, you want to protect your mucous membrane. So if you have eyeglasses, that's perfect. If you have a face mask, that's great. So these things are very important to do. And at the very least, you should always protect your hands. So if you don't have gloves, what do? Improvise. Perhaps there's a plastic bag that's laying around. You can use a plastic bag, or if there's some other type of non-porous material that may be present, you can use that. So now that you've got your hands covered, you need to see where the bleeding is coming from. So what do? You have to expose. So, if somebody has bleeding on their leg, you're not going to be able to see the source of the bleed, or you're not going to be able to see the bleed until you expose that wound. So you have to lift up their pants to, lift up the opening of the pants up to their knees, perhaps, if it's a lower leg bleed. So this is what the term exposed means. You want to look or view the area where the damage has occurred. So over here, when you look at this slide, they're talking about caring for external bleeds. And amongst the simplest things that you can do is to take a sterile gauze or a clean cloth and you put it over the wound. Okay, once you put it over the wound, what do? You apply pressure and you hold. Okay, and you want to hold and apply direct pressure for at least 5 minutes. And during this 5 minutes, you do not want to peak. So do not remove it, check after 2 minutes or 1 minute to see if it stopped bleeding, and then put it back on. Do not remove it again after another 2 minutes. Take it, look at it, and put it back on. No, every time you do that, you're just going to prolong the bleeding process. So cover it, apply direct pressure, hold it for 5 minutes. Do not move your hand or the pressure for that 5 minute period, 5 or 6 minutes. And after that point, then you may remove it to see if the bleeding has stopped, or perhaps at that point, if the bleeding is continuing and the gauze has been soaked, then you would need to change it and take other measures to control that bleed. When dealing with this, what do we do if the bleeding does not stop within 10 minutes? So perhaps, you hold it for 5 minutes, you remove it and there's still blood coming out, you hold it, you apply pressure again, hold it for another 5 minutes, and it continues to bleed. At that point, what you can do is just add more clean dressing and apply even greater pressure. So press harder and try to press harder over a wider range. After that point, what you could do is you could apply a pressure bandage over that dressing. So this is just the dressing. The first layer of gauze that you put on would be termed a dressing. What holds this dressing in place, excuse me, would be called the band-aid or the bandage. So this secures the dressing as well as applies pressure to it, long-term pressure, until that person is able to get to a hospital or see a doctor. So when we look over here, if the bleeding continues, again, what you want to do is you want to activate the EMS. You want to call 112. And you may consider using a tourniquet. And again, a tourniquet you want to use if the bleeding is severe from an arm or a leg, a limb in other words, and it cannot be stopped. This is when you want to start using these tourniquets. So it's important to know how to properly use this, and we're going to be going over the material, the steps on how to use this effectively. And the other thing is, last thing that we have down over here is disposed soiled material. So the gloves that you're working with, if there's any dirty bandages or soaked gauze that you may have, remove that. Okay, get rid of it. Do not leave it around where a child or another animal can come into contact with it and possibly get sick from it if there's any type of pathogen that's present in that blood. So always dispose of any soiled material. So anytime you open up a dressing or you end up using gloves, you want to dispose it. These are disposable items. You don't reuse it, and we don't leave it around for somebody else to come into contact with. So what do we do? All right. Now, as far as for wound care goes, or for the care for the wound, again, if need be, if you can't get the bleeding under control for 10 minutes, then you need to take them to a healthcare professional. So you need to take them to an urgent care center, an emergency room, or perhaps even a family doctor. And And essentially what they'll, once you get to the medical center, they're going to try to they'll probably end up cleaning the wound or irrigating the wound. After that, depending on how deep and how wide the wound is or how long the wound is, they may or they may not need sutures. Okay, and sutures we'll look at as well. It's another term for stitches. Okay, they're both the same thing. And the other thing is, sometimes when you have an open wound, and especially the type of wound that may result from, there may be need for immunization. So, there may be a tetanus shot that the patient would need. And usually we get one tetanus shot every 10 years. And as long as you have that, then, you're safe from tetanus. All right. Now, if we're not able to control the bleeding, all right, at that point, as they say over here, what do we do if you can't get the bleeding to be controlled? It's too much. If it's an arterial bleed or if it's a large venous bleed, and again, it's going to take you a good 20 minutes, 30 minutes, maybe longer to get that patient to an emergency room. Well, at that point, you have to start considering using a tourniquet. And, the tourniquet is going to end up controlling, hopefully, if it's applied properly, it's going to decrease the amount of blood that's being lost. So it's going to decrease the rate of loss, right? So it'll decrease the rate of blood loss. It may not necessarily stop the bleeding, but it'll definitely decrease how much blood you're losing. So what do you do if it's not available? Well, we'll talk about that as well. You can always improvise. That's one of the things when it comes to emergencies and health emergencies, is you improvise. You work with what is made available to you. If you don't have the equipment that's necessary, that's required, or the equipment that's standard, then you try and work with what is available to you. Yeah, so if there's a manufactured tourniquet available, great, go ahead and use it. But if we don't have a manufactured tourniquet available, then you can apply an improvised tourniquet. So once you apply this tourniquet, you do not want to conceal it, meaning you don't cover it. You do not want to release or remove it in any way. Okay, so in other words, prematurely, you don't want to remove it or release it. Why? Because, again, the reason you put it on was because there's a lot of blood that's being lost. And it's best to let a physician, a doctor, be the one to decide if and when to remove that tourniquet. The other thing is you want to document. Now, when you document, what's the purpose of documenting? The purpose of documenting is to let the next person who's going to be taking care of that patient know what time this tourniquet was applied. So the way that you document is, again, you end up writing TQ and then the time that the tourniquet was applied. Okay? So this is the process of documenting a tourniquet. So TQ, and then, so for example, if I put this on at 2:30 p.m., so then I would just write 14:30. And this would be my documentation. Now, where do you document this? You apply it on to the person's forehead. Okay, this is where it goes, on the person's forehead. So on the forehead, if you have a marker, great, go ahead. Use a marker, write down 14:30, TQ, 14:30 on their forehead. Or you can also take a piece of tape, and then on the tape, write down TQ, and then the time. So in this case, it's 2:30, so 14:30, and you apply it on to their forehead. This way, when a paramedic arrives or the patient goes to a doctor, they'll know exactly. It'll tell them two things. First of all, it's going to tell them that there's a tourniquet applied on that patient. The second thing is that they'll know what time it was applied as well. So when they do take it off and it's continuing to bleed, then they know, all right, this person needs to go up into surgery. All right, so having said all that, if a person needs a tourniquet, then they need professional care. They need to get to a medical facility. So you're going to have to call 112 to arrange for that transport. What are some other options, or if the bleeding continues, or perhaps you don't have a tourniquet available? There's other options as far as controlling blood loss or clotting, and that is it encompasses involving hemostatic dressings. Hemostatic dressings, essentially what they do is they help clot blood vessels. So you take this dressing and it's coated, it has some medication on it, there's some chemicals on it, and when these chemicals they come into contact with blood and blood vessels, they promote clotting. So they actually actively stop clotting in several mechanisms. There's several ways that they do that. So again, this is when you want to use this if a tourniquet is not available, or you can use this for perhaps if the tourniquet is not effective. Then you may even want to use it at that point. Or if a tourniquet cannot be applied, you may want to use this um, combat gauze. So again, these are actually they were designed for the military, for military use. When the soldiers they went into battle zones and they would end up getting shot, they would have gunshot wounds or any other type of wounds, shrapnel wounds, and there was a large amount of bleeding. These dressings would be used to help clot or actually decrease or stop blood loss. And again, it would raise the chance of survival for the soldiers. All right, now as far as applying a manufactured tourniquet, by the way, manufactured tourniquet, what that means is, again, this is a professional device. This system is designed and made specifically for the use as a tourniquet. This is its purpose. Okay, so again, they produce this to use as a medical equipment. So what's important behind this? What's important about using this? First things is that you always apply this tourniquet 2 inches above the bleed, above the wound. So for example, if the wound is over here, okay, or over here, in that case, then this band, the distance is about 2 inches. Okay, so 2 inches, you want to go, you apply 2 inches above where the wound is. And once this is applied, so you take this, it's kind of like a band, okay? It's a circular band. You take it, you secure it in place. The next thing you do is, if you see this rod over here, you start turning it. As you turn this rod, it ends up increasing the pressure. It makes this band tighter and tighter. So when you do that, now what you're doing is you're starting to compress the blood vessels. Okay, you're talking about compressing veins as well as compressing arteries, which will therefore decrease the loss of blood. So you apply this 2 inches above the wound. Once you apply this 2 inches above, then you start turning this in a clockwise position until you keep turning it until the bleeding stops, okay, or it slows down significantly. Okay, but generally speaking, again, as you tighten it up, the bleeding should stop. If it continues to bleed, regardless of how tight you make it, then you have a big problem. You should just, again, unfortunately, it's probably a very large blood vessel that's been severed, that's been injured. Now, after you do that, okay, once you turn this, the last thing that you do is that you secure the rod in place. In other words, you don't want this to spin back around the other way. So you have to tie this in place or secure it in place. And again, we'll probably see it in the next slide, which they don't have that. So in this case, this tape would kind of go over and this would hold this device, this rod, in its position, this knob in its position. Again, when I had mentioned documenting is very important. So we applied the tourniquet on this patient over here, okay? And the next thing that we're going to do is, if we have tape, perfect. On this tape, what's written down? TQ. What does that mean? Tourniquet, okay? What time's the tourniquet applied? And over here, they put down, in this case, 9:46 a.m. You can put down the same thing. You can put down standard time, or you can use military time. Again, if this is standard time, 9:46 a.m. would be 0946. Okay, and 9, if this was p.m., then what do we do? Again, this is going to be different. It's not 19 anymore, but what? It's going to be 1946, right? So again, this is military time, this is the standard time. You have to document what time this was put on. And in this case, again, they used tape. They wrote over the tape and they stuck the tape to this patient's forehead. If you do not have tape, just take your marker and write, you just write over here, TQ 0946. Okay, that's it. That's all you need to do. If you have if you don't have a tape, no problem. Write it on the forehead. And again, when the physician, the doctor, the paramedic, when they come, they see that, they'll know that the tourniquet has been applied, and they'll have a better idea of as to what they're dealing with. Now, what do you do if a tourniquet is not available? So if a tourniquet is not available, you improvise. You use what you have. So if you have a wide roller bandage, if you have a triangle bandage, if you have, I don't know, some type of a cloth that you can use as a long band, which is, hopefully it's about at least 2 inches wide. So as long as it's 2 inches wide, then, you're in pretty good shape. And hopefully it's long, okay? And hopefully it's a little bit somewhat thick, so it'll help apply pressure. So you can use this, all right, instead. No tourniquet available, no problem. As long as you have something else that you can use, or it can even be a shirt. If you have an old shirt that's laying around, you can even use that. So, all right, in this case, now what are we doing? So you you take this band or this cloth that you have, all right, and or perhaps if you have a scarf, okay. Right now is winter time. A lot of people are wearing scarves around their necks. Perfect. That could be used as a tourniquet. So, it's tourniquets. They could be easily improvised. So you take, whatever that you have available to you, whether it's a triangle bandage or just a roller bandage that you may have, or it could be a scarf that you have. Take it, wrap it around 2 times. Again, you're going to go 2 inches above the wound. Okay. 2 inches above the wound. You always want to go above that. So in this case, let's just imagine the bleed is right over here. And so this distance is roughly it's about 2 inches. So 2 inches above, this is where you're gonna wrap this tourniquet around, this band, let's just call it. And you wrap it around 2 times. Okay, so you take this around 2 times, 1, 2. Once you take it around 2 times, then you place a knot. Okay, you tie a knot around it. So you can see over here, she's tied a knot. She's pulling one side here, and the other side she's pulling that way. Now, one thing that is not been said over here, okay, and that should have been said. If you have a dressing available, okay, if there's a dressing or some type of padding available, put that on first. Okay, put on that first. Why? Because it's going to help secure this in place. It's going to prevent it from sliding around. If you have it, great. Put that on first. If not, don't worry about it. It's not a deal breaker. You can still work. You can still achieve what you're trying to achieve, which is to control the bleeding. All right. So the next thing you want to do is you want to secure the secure the knot. Okay? Secure the knot and how much pressure to apply. So at that point, you can try to put some type of a rigid object onto that knot. Okay, so she's using a screwdriver over here. Okay, if you don't have a screwdriver, you can use a spoon. You can use, a cup, a marker, a pen, anything that's hard. You just want to put that over there. Why? Because what you want to do next is you want to tie a square knot. Okay, you want to tie a square knot around that. So again, a square knot, you're going over 4 times essentially. That's all it is. And again, once you put the square knot, now what you do is you start to twist. Okay, you're going to start twisting this around and around, because what you're doing is you're creating pressure now. You're creating additional pressure. So you turn this until the bleeding stops, all right? So once you put a square knot over here, you start to turn it, and as you turn, more and more pressure gets created. And when the bleeding stops, at that point, you can stop turning this object, whatever it may be. At that point, then you want to secure that object in place. Okay, secure the object in place, in position. So remember, if we go back over here, this was the object that we were turning, okay, in a clockwise position. Well, this was a tourniquet. This is a system. This is a professional medical device. We don't have that available this time. So what do? We just found a band or a scarf or a muffler from somebody. We wrapped that around a couple of times. We made a knot, our initial knot. Then we found a screwdriver or a pen or a marker, and we made a square knot around that. Once we produced that square knot over here, we turned it about, I don't know, maybe 4 or 5 or perhaps 6 times until the bleeding stopped. Now, once the bleeding has stopped, now we need to secure this in place. Okay, and it's that last step that we're going to be doing over here. So once that has been done, what do? Same thing that we did before, document. So again, when we document, what do? Put TQ and the time. Now say this time it's 6:30 p.m. So let's just put down 6:30 p.m. Or perhaps, if you want to use military time, 18:30. That's it. So whichever system you would like, you can use. If you have tape available, great. Write this down on the piece of tape and then tape it to their forehead. If you don't have tape available, you just write it down over here with the marker. Okay, as far as internal bleeding goes, so with external bleeds, typically you can see them, right? And you may need to expose the area of the body to see it, or you may not. Generally speaking, with external bleeds, you will see blood on the patient's clothes or on the ground or in the area that they're sitting in or laying down in. Now, for internal bleeds, you may or you may not see bleeds. There may not be blood present. Blood is not always present. When there is an internal bleed, if it's coming from the mouth or the rectum or perhaps in urine, the blood is usually bright red in color. Okay, and again, usually bright red is indicative of an arterial bleed. There can also be non-menstrual vaginal bleeding that we would observe in females. There can also be blood present in vomit. Okay, so again, oftentimes when someone vomits, there might be blood there. Well, that's kind of telling you something as well. There's an upper GI bleed possibly. Or again, you're talking about bowel movements. So in stool, in feces, if there's discoloration, perhaps a black color or foul smelling, a tarry stool, that could be indicative of a bleed. Aside from that, if the person has pain, any tenderness, bruising, or swelling upon palpation, that may be indicative of an internal bleed as well. So again, typically it tends to be rather painful when you touch a specific part, perhaps it's over their abdomen. You're going to have tenderness that's present. In addition to that, you may or you may not see bruising. Okay, so that's possible. And also, aside from that, there may be edema that's present. Okay, so you may see some swelling. Other times, there could be a broken rib, there could be bruises over the chest, or there could be an abdomen that's rigid. These would all be conditions where there's internal bleedings that may be taking place. So what do you do when you have a patient or you suspect a patient with an internal bleed? Well, the first thing is you want to monitor their breathing. What's the rate of their breathing? What's the depth of their breathing? Hopefully there is a rate and the depth of the bleeding. If there's an absence of breathing, then you're in a different situation at that point. Now, when someone does have internal bleeding, you should expect vomiting. So, it's wise to put that patient in a recovery position. Okay, so you'd want to have that victim, if possible, in a recovery position. You always want to treat them for shock. Again, why? Because there's blood that's being lost, and you can't really control internal bleeds. If it's of a limb, an internal bleed within a limb, you may be able to control it by applying a splint. Okay, that may be an option. But again, you're actually limited as to what you can do for internal bleeds. Again, it depends on where that bleeding is occurring inside. If there's if it's an organ that's involved that's causing the bleeding, or if it's a deep artery or a deep vein, you're limited as to what you can do in terms of applying external pressure. Of course, in these situations, advanced care is needed. So this person needs to get to an emergency room, or possibly a surgical suite. Now, if you have bruises, they're rather common. Someone can get a bruise, for example, playing football or playing basketball, or even just falling down the stairs. Or sometimes, if you just by mistake you end up banging your hand or your leg on a desk, a table, or a door. All these could result in a bruise. And remember, bruise is just a little bit of blood that's collected, or it's blood that collects underneath the skin. This is what a bruise is. So what do you do? Well, if it's on an arm or a leg, if it's bruised, then you want to apply an ice pack. So the key is you want to apply it immediately after the injury. So again, take your ice pack, 20 minutes, you want to apply it for. And, what you should be doing is 10 minutes on, you apply it for 10 minutes, and do not take it off. Make sure it's there for the full 10 minutes. After that full 10 minutes, you can remove it for 20 minutes. And then again, you want to repeat this 10 minutes on, and then you can take it off again. So every 10 on, 20 off, 10 on, 20 off. And that's going to end up decreasing the amount of blood or decreasing the amount of bruising that's taking place. So if you have an arm or a leg that's bruised, in addition to icing, you can also apply a compression bandage. So like if you can find an elastic compression bandage, that works very well as well. So an elastic compression bandage works rather well. You can take several layers of gauze pad, or maybe you can find some type of a cloth between that bandage, and you can apply it above that injury as well. Again, as long as you're applying, the main thing what this is doing is this is creating pressure. So if you apply pressure, you're going to decrease the amount of blood that's being lost and that's collecting underneath the skin to decrease the bruising, the discoloration as well. So that's it for this lecture.